Now, moving on, Africa Center for Disease Control, in partnership with the World Health Organization Regional Office for Africa, hosted by Uganda, will hold a one-day high-level ministerial emergency meeting on Wednesday this week to discuss the Ebola outbreak. Speaking during the weekly update on disease outbreaks on the continent, the Africa CDC Acting Director, Dr. Ahmed Ogwell, said the meeting has been convened to discuss cross-border preparedness and response to disease outbreaks in the region, including Ebola in Uganda.
Africa Center for Disease Control Acting Director Dr. Ahmed Ogwell, during the weekly virtual update on disease outbreaks on the continent, noted that the biggest challenge is that the Sudan strain of Ebola in Uganda does not have rapid test kits that can determine who is infected. The strain can only be tested in an established laboratory, and at the same time, there is no vaccine to help protect the public from severe illness when infected. He further added that the rapid test kits like the ones used in COVID-19 cannot be used in testing for Ebola, as only a PCR test is viable.
We don't have rapid test kits yet, and we also do not have a vaccine that has achieved emergency use authorization, and therefore we cannot use that particular tool in our response mechanisms. We are providing support for the isolation of cases that are suspected or confirmed. We are providing support to ensure that members of the public are being given the right information across the country. Indeed,
Dr. Ogwell, while responding to questions, say the spike in infection and deaths from COVID-19 in neighboring Somalia calls for the need to protect the population by increasing surveillance as well as vaccination.
If you drop your mask wearing when you are gathered with people, you expose yourself. If you're not vaccinated, then you're more likely to become very ill and therefore resulting in death. So all these are challenges that have contributed to the spike that we are seeing in Somalia.
On his part, the medical epidemiologist at Africa CDC, Dr. Merawi Arago, say the high number of medics infected with Ebola in Uganda was because the infection presents the same way as malaria. 10 medics in Uganda were infected with Ebola hemorrhagic fever and 4 have died.
The Ebola sign symptom is like any other acute febrile illness, like the malaria, meningitis, and so on. So because of that, health workers are usually exposed until we sort that out and catch it and diagnose it very well. Then all the care and especially infection prevention control measures are put in place. We have noticed that the infection prevention control measures that need to be observed by all healthcare workers are some challenges there.
Africa CDC is now planning to send more test kits and personal protective equipment to Uganda to ensure the protection of medics fighting the spread of the Ebola virus. This even as Africa CDC is set to hold high-level ministerial emergency meeting on Wednesday, October 12, 2022 to discuss the Ebola outbreak.
I invite you to engage with us and participate in the public sessions of the October 12th meeting, which we'll be holding in Entebbe in Uganda.
Countries expected to attend include Kenya, the Democratic Republic of Congo, South Sudan, Rwanda, and Tanzania. Opicho Chemtai for Lunchtime News.